Welcome to our Neonatal Nurse interview preparation session. Today, we're diving into some key questions you might encounter, helping you feel confident and ready. Let's kick things off with our first question. Can you share a time when you faced a high-pressure situation in the NICU and how you handled it? This question helps interviewers understand your stress management skills and how you function under pressure. Let's explore some strategies to effectively answer this question. Start with a clear and specific situation you encountered. Describe the actions you took to address the situation. Highlight the outcome and what you learned from the experience. Emphasize teamwork and communication during the incident. Use the STAR method: situation, action, result. Now, here's an example of how you could frame your response.
During one shift, we had an unexpected surge of preterm infants needing immediate attention. I quickly assessed the situation, collaborated with my team to distribute resources, and liaised with the attending physician for necessary interventions. Thanks to our coordinated efforts, all infants received timely care, and I realized the critical importance of fast communication under pressure.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for neonatal nurse. It also includes example answers and tips to help you prepare with confidence. The download link is just below. How do you manage your tasks when caring for several neonatal patients at once? This question gauges your time management skills and ability to prioritize in a busy NICU environment. Here are some tips to help you craft a strong answer. Assess the immediate needs of each patient first. Use a systematic approach, such as the ABCs: airway, breathing, circulation. Involve your team to delegate tasks when necessary. Keep organized charts to track patient status and priorities. Communicate effectively with team members about changes in patient conditions. Let's look at an example response.
I begin by checking each patient's vital signs and prioritize those who are most unstable. For instance, if one baby is showing respiratory distress, I address them immediately while ensuring my team monitors the other babies. This way, everyone receives the necessary attention.
Can you describe a situation where you led a problem-solving effort in the neonatal unit? Interviewers want to see your leadership qualities and problem-solving skills in action. Consider these tips when structuring your response. Identify a specific problem or challenge you faced. Explain the steps you took to address the issue. Highlight how you communicated with the team or parents. Emphasize the outcome and what you learned. Show your ability to stay calm and make decisions under pressure. Here's an example of a well-rounded answer.
In the neonatal unit, we faced a situation where a baby's oxygen levels were fluctuating. I organized a rapid response team meeting to identify potential causes, collaborated with the respiratory therapist to adjust settings, and monitored the baby closely. Our efforts stabilized the oxygen levels, leading us to improve our monitoring protocols.
How would you explain a complex medical procedure to a neonate's parents in simple terms? This question evaluates your ability to communicate effectively and empathetically with families. Let's go over some strategies for breaking down complex information. Start with the basics of the procedure in simple language. Use analogies that relate to everyday experiences. Encourage parents to ask questions to clarify their understanding. Be empathetic and patient, acknowledging their concerns and fears. Summarize the key points at the end to reinforce understanding. Here's a sample way to approach this communication.
I'd start by saying, the procedure is like a routine checkup, ensuring the baby's health. For a blood test, I'd compare it to taking a tiny sample, similar to checking the water in a fish tank to ensure it's clean. I would invite questions to help parents feel more comfortable with the process.
How would you support a family facing the possibility of losing their newborn? This question measures your ability to provide emotional support and communicate compassionately during difficult times. Let's explore how to approach this sensitive topic with care. Acknowledge their emotions and provide a safe space for them to express feelings. Use clear, compassionate language and avoid medical jargon. Provide consistent updates on the newborn's condition and treatment options. Encourage them to ask questions and involve them in decision making. Offer resources such as social work support or grief counseling. Here's a compassionate way to handle such a situation.
I would create a compassionate environment where the family feels safe to express their emotions. I would clearly explain the situation, provide regular updates, and encourage questions so they can be part of the care process. Additionally, I'd refer them to counseling services for further support.
Before we wrap up, remember you can get all 30 questions, example answers, and step by step tips in a handy PDF. Totally free. Just grab it below.